Why should I care? And by I mean, why should society care? Why should I care about getting these folks treated well in correctional facilities? Why should I care about getting them treated well in the community once they're released? Why do I even care? Why should society care?
Well, there's a variety of reasons why we should all care. First of all, if you just want to be selfish and think of yourself, when patients are not treated in the community, everyone is at risk, because the patients that do become violent, as we talked about with schizophrenia and other mental illnesses, are most commonly when they're not stabilized, they're not treated, and when they're abusing drugs and alcohol. And that combination does put the community at risk, as well as having to pay for those illnesses. We hear some payers say, well, why pay for their treatment anyways? They don't function. Well, that's like saying to patients with Alzheimer's, why give them medication for their memory? They can't remember it anyways. It's part of the illness. And the better we treat them, even in facilities, we get them out of facilities, they're certainly safer, and they can be productive when we give them the chance in community.
I'm paying. We're all paying for these facilities. They're expensive, right? They're expensive places to keep people, and they're expensive places to treat people. Doesn't it make more sense to treat them well, keep them from relapsing? What do you think? Can you put a dollar amount on how much we'd save if we got these folks well treated and they didn't come back?
Well, it's not only the savings, it's also the avoidance of certain costs. I mean, a lot of these individuals, once they're in recovery, can work and pay taxes and live a very productive life. Why do we care about treating people with cancer? Why do we care about people with heart disease? These are just other illnesses, and it's incredibly offensive to me that they're not treated this way. I'll tell you something. I've been doing this almost 18 years. If we treated people in this society with primary health care issues, the way we treated people with serious mental illnesses, not only would there be a plethora of civil lawsuits, there would be indictments for gross negligence. I don't get it why it's acceptable to discharge people in the middle of the night with very, very bad illnesses, and then we don't give them what they need, and then we punish them by arresting them because they don't get what they need. Recovery rates for people with serious mental illnesses are better than for people with heart disease and diabetes.
Because who's their advocates?
Well, that's
they're not voting, and they're not the you draw attention to. In fact, when you see someone with schizophrenia on the street, you tend to walk away or look away, and no one is really advocating for them, unfortunately.
Isn't that the essence of it? It's a me, not me.
Well, I think it's more complicated than that. I think we know more today than we knew 10 years ago about these illnesses. I think people were afraid of it. There was a lot of stigma. Now that we're starting to understand it, the laws and the money have to start to catch up to it. But to not do it is criminal.
But actually, to the judge's point, it is actually not the cost of the treatment. It's actually the cost of these individuals not contributing to society.
That's what I was getting at.
That is the
There's a
major,
huge cost.
Absolutely.
It's
To all of
enormous.
us.
It's the cost of not treating, actually.
Right.
It's so much
Got it.
more effective to treat them and keep them out of correctional facilities and potentially in the workforce and part of their families. They get very quickly estranged from their families when they're not being treated.
And their hospital costs, too, which are even more than the correctional cost. And so we know that with good treatment, recovery rates are good, people can live productive lives, and they don't hit these high-end acute systems.